Is hydralazine effective for resistant hypertension? Have you ever wondered if hydralazine can help with resistant hypertension? Let's break down how this medication works and its role in managing high blood pressure that doesn't respond to standard treatments. Hydralazine is a direct vasodilator. This means it relaxes the smooth muscles in the walls of your arteries. When these muscles relax, the arteries widen, which helps lower blood pressure. It mainly affects the smaller arteries, known as arterioles, and tends to lower diastolic blood pressure more than systolic blood pressure. However, there are some important things to consider. When blood vessels dilate, the body may respond by increasing heart rate and cardiac output. This is because the drop in resistance can trigger a reflex response. Additionally, hydralazine can lead to sodium and water retention, which might limit its effectiveness unless used alongside a diuretic. In the context of resistant hypertension, which is when blood pressure remains high despite using 3 different classes of antihypertensive medications, hydralazine can be considered as an additional treatment option. Managing resistant hypertension usually starts with confirming that patients are taking their medications as prescribed and ruling out any secondary causes of high blood pressure. The preferred approach often includes maximizing doses of long-acting thiazide-like diuretics and adding medications like spironolactone. Spironolactone is a mineralocorticoid receptor antagonist that has strong evidence supporting its use in resistant hypertension. If blood pressure is still not controlled, doctors may then consider adding hydralazine or other medications with different mechanisms of action. While hydralazine can effectively lower blood pressure, its side effects, such as fluid retention and increased heart rate, requiring careful management. This often means using it in combination with diuretics and beta blockers to balance out these effects. In practice, spironolactone is usually the go-to choice for patients with resistant hypertension. It works by blocking aldosterone, a hormone that causes sodium retention and can lead to higher blood pressure. Hydralazine might be added later if blood pressure goals are not met, especially in cases where other medications are not suitable. To sum it up, hydralazine can be effective in lowering blood pressure through its vasodilatory effects. However, it is generally not the first choice after trying mineralocorticoid receptor antagonists like spironolactone. Its role is more significant in specific situations, particularly when other options are not effective or tolerated. Always consult with a healthcare provider to determine the best treatment plan for resistant hypertension.